coronavirus sexes. This is your ticker guy. It's the 17th. Hey, let's talk staged opening and stupidity. I want to read you something here. All right, physician on one of my threads from this morning talking about, and as I've been talking about this whole nursing home and lockdown thing, and actually locking in nursing facilities. Okay. Small rural town, 2 nursing homes. One is part of the hospital and controlled by MDs, and this particular poster sits on the board. He's an MD. The other one is part of a huge multinational corporation. The very morning after Kirkland, before deaths, they locked down prison-like our hospital-affiliated MD-controlled nursing home. The employees could only leave once a week, and they are getting handsomely compensated for this sacrifice. We have had absolutely nothing happen. No cases. The other nursing home could not be bothered. Their management feared disrupting anyone's lives. They are now up to 18 positive cases and 2 deaths, 4 people critically ill in the hospital. Yeah. So, if you go back and look at the statistics, ladies and germs, you will find that if we take out the hospital and nursing home acquired infections for COVID-19, we also take out half or more of all of the deaths. And all of a sudden, this disease looks an awful lot like the flu. In fact, it looks like less than the flu, seeing as the flu manages to get about 50 or 60,000 people a year, and that would drop the number of deaths from COVID-19 by half. It would have obviated any necessity for screaming about running out of hospital beds, ICU beds, ventilators, or anything else. In other words, it would have been a disease that got a few people here and there. Yes, we'd still have some death. It does kill people. But the disaster, the need to destroy the economy, that all of these things absolutely would not have happened. Secondly, as I keep pointing out, all of the mitigations that took place after the curve rolled over in terms of effective infection rate. And I don't care which formula you use to compute, it doesn't make any difference. Listen, folks, just take the delta percentage of new cases per day, because cases are cases, okay? Look, you cannot use deaths between nations or between metros or between whatever to compare. That's an invalid comparison. Why? Because one nation has better health care than another. One nation has more fat people. One nation has more diabetic people. One nation has more people with cardiovascular disease. One nation has far more people who smoke. All of these things are risk factors. Unless you can norm for that, which you can't possibly compare death rates and get anything meaningful other than to say that there's more comorbidities in one place than another. But cases are cases are cases, okay? Proved infections are proved infections. And as long as a particular jurisdiction uses a consistent metric for when you can get a test, i.e., as we've done in the United States, I cannot right now walk up to or drive up to one of the COVID testing places and say, I want to be tested for COVID-19. They're going to ask me a bunch of questions. Do you have a fever? Yes or no? If you do have a fever, what is your fever? How long have you had it? There's a gating protocol to get the test. As long as that stays in the same place, we have consistent results. And if it doesn't, then you get a dislocation in the data. So if some jurisdiction play games with that, and some will and have, Wuhan did it several times when they were reporting their numbers in the early part of this pandemic. And by the way, I caught them several times just from their reported case counts. Those of you who have been following my blog and my podcast know this. I pointed out there was a dislocation in the data. Why was the dislocation? Because they changed some condition of the test. What was it? I don't know. I don't need to know. I just know what happened. Okay, we haven't seen that in the United States. Okay, in general, that kind of problem hasn't come up. So here's the reality, though, folks. All of these curves rolled over before the mitigations could be put in place. The slope did not accelerate when the mitigations took effect. If they were a singular change, then there should have been a step function when those lockdowns took effect. Because if you reduce people's person-to-person contact by 90% or 95% or 98% or whatever it is, okay, at the instant that you do that, the rate of transmission falls. Not slowly over time, instantly, at that moment. If you lock me in my house and you tell me that I can't go to the bar and eat chicken wings and drink beers, well, whatever infections I could pass along as a result of going to the bar and drinking beers and eating chicken wings ends on that day. It doesn't end 10 days later. It ends on that day. And somewhere between 5 and 15 days later, that shows up in the hospital stats. But it shows up as a step function. And then it's over. But that's not what happened. We didn't get any step functions. We had a slope established prior to the mitigations going into effect, and the slope didn't change. If anything, it's flattened out as we've gotten closer to 1.0. In other words, you could make an argument that the mitigations actually had a negative impact. They actually were deleterious as opposed to beneficial. And actually, maybe that's true because they slowed down the building of herd immunity among people who don't get sick, or at least not seriously sick. You see, when you lock healthy people in their homes, they don't get infected as often, but they don't have bad outcomes. So people in the nursing homes, for the most part, not exclusively, but statistically speaking, they're the people who have the bad outcomes. So you could actually look at the data and you could form a cogent hypothesis that the lockdowns and destruction of the economy actually made it worse, in that it stretched it out and increased the amount of time that we're going to have these problems. Now remember that the latest, newest scold is that now the goal is not to prevent the healthcare system from being overloaded. Now we have to essentially eliminate almost all cases and almost all forward deaths. And that is the gating factor. Remember, we've got this in our gating factors that the government has put out for their new reopening phase 3 guidelines. Well, so we're no longer, the issue is no longer whether or not we have enough ICU beds and enough medical system capacity in order to deal with it. And oh, by the way, one of the requirements is that you have enough surge capacity in each area before you reopen. How can you have, what surge capacity? Where would you expect there to be a surge? Well, couldn't we look at where there has been one? Well, there's been one in New York, there's been one in Detroit, there's been one in Chicago, there's been one in a handful of other places. New Orleans got hit pretty hard, okay? All these places got hammered, but the crazy hammering that we were supposed to get didn't happen, except in a handful of little metro areas. And even there, it's rolled over. Oh, but it's because you guys have been so good. No, it isn't. It isn't about nothing of the sort. But what have we done? We've destroyed the economy. We've put 20 million plus people out of work. We still have governors falling over themselves playing Hold My Beer, all right, even today. And we have not done a thing other than give lip service to protecting the most vulnerable. Oh, that is in the new guidelines. Yes, let's protect the most vulnerable. Well, why don't you lock in the nursing homes? Is that part of the guidelines? Of course it's not part of the guidelines. But you know what? Hey, listen, I got a report here, right here from an MD. 2 nursing homes in the same town. One of them has no cases and no problems. The second one gets pounded. Well, now there's another problem. Are you going to actually ever solve that issue by doing... No. Do you know why? Because the only way that you're ever going to be able to solve this is that you can't lift those shut-ins, right, on a permanent basis, because those people are still vulnerable. So what are you going to do? You're going to require that all people who are staffers go get deliberately infected, quarantine, prove antibodies, then they're safe. Okay, that's one approach. Well, what do you do about their relatives? Yeah, see, this is the problem, folks. The goalposts that we have when it comes to some of these populations are unrealistic. They're total BS. And as I related on Stocks and Jocks this morning, I have a very, very close family friend who had his grandfather killed by this thing. And as I've said before, it's a legitimate COVID-19 death. Okay, it's not an overinflated one like what they're doing in New York. Now, if you have a heart attack, but you might have had COVID, they don't even have to test you. Oh, well, you had a heart attack. By God, that's a COVID death. And all of a sudden, 2,000 or 3,000 more people showed up on the dead rolls that they had no evidence that this was actually part of the causal chain that led to that person's demise, but we're going to count it anyway because it makes the numbers look better for us. Yeah. But as I pointed out, this gentleman, very old, in his mid-90s, plenty of comorbidities. He was killed by this thing and legitimately killed by it quite quickly. His wife, to whom he was still married, they'd been married forever, and she tested positive. So she actually had the virus, but she never got sick. She's fine. She never got sick at all. She never even got a sniffle. Okay? So the idea that inevitably, if you have these comorbidities, this thing's going to hammer you is not true. All right? She got the virus, and yet now presumably at this point she's immune. She's fine. Of course, her husband's dead, so that's not so good. But nonetheless, she, at least for some period of time, should be safe to wander out and about and go do whatever it is that she wants to do because she shouldn't be able to get it again. The thing that's very, very annoying about this, though, is that we're ignoring that that's probably what's going on in these other nursing homes. So you have, half the residents that got it and had very bad outcomes. They either ended up in the hospital, ICU, or they're dead. But the other half probably got it too. They're just in some asymptomatic. And you know what? We're not looking at that, are we? No. So, folks, look, at the end of the day, you, America, you have to decide. Are you going to stand for this so-called gradual nonsense, which when these mitigations and these things that they did absolutely nothing? All right, if this bug is going to come roaring back, it's going to come roaring back. And oh, by the way, if the reason for the decline is herd immunity, then it is what it is. Whether it's cross immunity with some other coronavirus that most of us have had, or at least a decent percentage of us have had. Remember, coronaviruses cause a decent percentage of both flus and colds. So there may be a decent amount of cross immunity in some of the population. We don't know this. We know that specific virus is relatively novel. Or the other possibility is that it's spread a whole lot further and faster than we think, and a huge percentage of these people are already immune. And therefore, there's nothing to be worried about with those people. And we had our spike, and it's over. One of those two things is going to be the case. Now, what we don't know is whether or not these antibodies wear off. We have no knowledge of that. So it may very well be that we come into the fall and the winter, and we get pounded again because most of the people who've had it, their antibody protection has waned. And for those people who haven't had it, then they get screwed because they had, again, no protection, right? And again, folks, I'm everybody's talking. Two more things. First off, the vaccine thing is a pipe dream. All right, and those people who are saying that we have to stay with these social distancing and other measures until there's a vaccine, well, guess what? You need to ask them point blank. What if there's never a vaccine? Because there's never been one that works for coronaviruses, ever. So, are you saying that we can never have leisure and hospitality again? Never. We can never go to church and sit in the pews with everybody. We can never do that. We can never go to a concert. We can never go to an amusement park. We can never have any of those things. None of those things will ever exist ever again in America. Well, you know what? Let's just build the gallows right now because that's BS. All right? If that's their position, let's just do it and be done with it. And then the other thing is this thing that spiked the market yesterday after the close, Remdesivir, I think is the name of the drug. I'll get the pronunciation right eventually. It's a Gilead drug. Folks, I read that study. Okay, it's been out for a few days. There's been some talk about it. Does it help people? Yeah, it's better than nothing. But listen, it's not peer-reviewed. It's not controlled. It was compassionate use on people that were extremely ill. This is the same kind of thing as giving people hydroxychloroquine alone with no Z-Pak and no zinc, and then saying, oh, well, it doesn't work very well. Well, you know what? This doesn't seem to work very well either. Would I take it if I had no alternative and I was dying? Well, yeah, I would. That's like when AIDS first started. People were trying all kinds of things that ended up being worthless or very close to it and had very, very serious side effects. And yet, if you're dead if you don't take it, what the hell's the difference? Right? I mean, go ahead and try. Why would I not? And we're kind of in that sort of a box with regards to this, I think. So let's use our heads. Let's be intelligent about this. I know most people aren't. But that's where we are, folks. And we just need to decide, does government still have our consent given these facts? Look, the data is irrefutable. You cannot argue with it. It is what it is. What you choose to do with that, is up to you. I'm your ticker guy.